Hello, dear students. Again, very warm welcome to all of you at our conceptual brainstorming integrated anatomy session, where we only do not prepare for the PG exams, but we start from the very basics, from the undergraduate level. We go through our theory books, the lines, whatever the book, whatever the language you prefer, you want Hindi or English, according to demand of the student, we go through the line by line of the textbook and also the beautiful images for our central institute exams. Yes, as you know, in our NEET, next, our PG entrance exams for our AIMS, PGI Chandigarh, NIMHANS, JIPMER, this all, there is the pattern on the image based. Also the clinical integration, as I teach the surgery, medicine, radio, your different kind of the other subject like the patho, pharma, microbiology, biochemistry, physiology, all the different subjects. So having the good idea how to integrate the different subject together, and it is the demand of the National Medical Commission. Yes, it is a demand of the National Medical Commission. It is the demand of the our competency based medical education. So we are doing same thing at this platform. So stay connected. You will get this recorded video at the app also, so you can download the app. You can join the free batches also, lockdown batches also, so that you can get maximum benefit. And right now we are doing the various back to back live classes for the benefit of the students. Okay, so now right now we are meeting for the thorax part with the proper three-dimensional orientation. So can you see this thoracic cage? Yes, let's start. See here, this is the thoracic cage. Head, neck, face part. Below this scalp, face and the neck, this is our trunk part. With the trunk part, upper limb and the lower limbs are attached. Again, this trunk part is divided by the musculotendinous structure. It is divided by the musculotendinous structure. Can you see this structure? Yes. Look it properly. I am rotating this one. Okay, see here. Observe this one. Yes. This is the muscular structure, and at the center, can you observe the center part? Look here. This central part is tendinous in nature. So this is musculotendinous structure. This musculotendinous structure is known as our diaphragm. How many diaphragms in our body? 7 diaphragm in our body. Okay, and according to the few books, 8 diaphragm also. Yes, I am just enumerating. In detail class I will teach you. See here, diaphragma celli, which is separating the our pituitary gland from rest of the brain. Then you can say the iris is separating the anterior chamber and the posterior chamber within our eye. Any structure which separates the two cavity, कोई भी स्ट्रक्चर दो अलग अलग कैविटीज को जो अलग करता है, that is the diaphragm. So remember, diaphragm is not only one structure in our body, many diaphragms are found. Another diaphragm here, touch at this part, just touch at this part. This part is muscular, this part is muscular. Okay, it is separating oral cavity and the neck. So this structure is mylohyoid muscle. Remember, this mylohyoid muscle, it acts as the diaphragm between the mouth and the neck. And then come down the question from the NEET 2018, the Simpson's fascia, also known as suprapleural membrane. This Simpson's fascia or the suprapleural membrane, it is a diaphragm between neck and the thorax. And then next number is our thoracoabdominal diaphragm, this one. Yes, this is the thoracoabdominal diaphragm. The thoracoabdominal diaphragm is the diaphragm between the abdominal cavity and the thorax. Then come down at the downside in abdomen segment, I will teach you, there is the our pelvic diaphragm. That pelvic diaphragm is dividing our abdominal cavity with the pelvic cavity. And then more down, when you will come more down to the pelvic diaphragm, there is the urogenital diaphragm. We will see the urogenital diaphragm, which is the our muscular structure at the genital region, urinary tract region. So that is the urogenital region. And then when you are coming down in the femoral triangle part, so in the femoral triangle part, there is a femoral septa. So as we will progress for the anatomy, one by one we will look this all the things. Okay sir, so just I want to tell you about the our thoracic cage. Just few information about the thoracic cage. See here, what is the thorax? Thorax is the cavity, bony cavity between the suprapleural membrane and the thoracoabdominal diaphragm. So it is bounded, boundaries, I am saying the boundaries. Above it is lined by the suprapleural membrane, also known as Simpson's fascia. Yes, this is also known as Simpson's fascia. Then see here, downside the thoracoabdominal diaphragm. Front, can you observe here, the front boundary is formed by this manubrium, then body, and this is the xiphoid process. These three structures consist of the our sternum. So sternum is making the entry boundary, and then here you can see this all are the lateral boundaries. Yes, the ribs are making the lateral boundaries, and then posteriorly, can you see, posteriorly the vertebral column, is making the our boundaries of the thoracic cavity. So remember the thoracic cavity, read the anatomy in your own body, judge it. Yes, in the front, palpate it, you can see there is our, yes, there is our sternum. Okay sir, on the each side 12 pairs of the rib. Yes sir, and on the back side our vertebra, thoracic vertebra, can you see the vertebra? Yes, this is a single vertebra, thoracic vertebra. The T1 to T12 thoracic vertebra, they are making our posterior boundary of the thoracic cavity. Okay sir, can you see the thoracic vertebra? What are the different parts of the vertebra? So just observe here, this is body. Okay sir, and when you are looking on the lateral side, this is transverse process. Fine sir, and when you are looking on the back side, this is the long spinous process, this is spine. Yes, body. Fine sir, transverse process. Yes sir, and then here is the spine. Getting the point? So when we will take our classes, most of the classes we do in our sketching manner, where we draw the diagram, as you all are aware, but this is the 3D session, so just I am using the 3-dimensional way. Okay, so these are the parts. What are the other parts? See here, the transverse process is attached with the spine with this flat part. This flat part is known as lamina, while the another narrow part between the transverse process and the body is known as pedicle. Okay sir, and the characteristic feature of the thoracic vertebra, that on each side you will see our articulating surface for the ribs. Getting the point? So these are the different points. Now try to understand. Yes, how many pairs of the ribs are found? You will say, sir, 12 pair. Yes, how many pairs of the ribs are there? 12 pairs. First, second, third, fourth, fifth, sixth, seventh, eighth, ninth, 10th, okay, and 11th and 12th. So among this, remember the few interesting question. Sometimes extra rib is present. Sometimes extra rib is present just above this first rib. Sometimes extra rib is present above this first rib, known as our cervical rib. Yes, old edition for your Central Institute exam, old editions of the textbook, they were saying how many individuals are presenting with the cervical rib. Answer was the 0.5%, but the recent Grace student edition, it is saying yes 1%. So incidence of the cervical rib has been increased. Yes, clinical integration, at this part there is a subclavian artery, subclavian vein, and our brachial plexus. So due to the cervical rib, these all the structures are compressed, and due to the compression by this different structure, there are the arterial system, venous symptoms, and nerve related symptom at the upper limb. Getting the point? So you have to remember the different clinical manifestation appears due to the our cervical rib. That's why that rib is important. And in the same way, 13th pair rib, the 13th pair rib, that is gorilla rib. Sometimes, can you see here? Yes, 3-dimensional anatomy, can you see this is the our last pair of the rib, 12th pair, but sometimes below it extra rib is present. That extra rib is known as gorilla rib. Getting the point? And now try to understand the space between these two rib, space between these two ribs. This is the single rib. What you can do description? Anterior end. Okay sir, and here is the posterior end. So two end. Yes, borders, just see how many borders of the rib, upper border and the lower border, two borders. And can you see the surfaces? Yes, there is a outer surface and inner surface. So you can say there are the two surfaces. What are the two different surfaces? There are the two surfaces, outer surface and the inner surface. Okay, so two surfaces. Yes, sorry dear students, This capacity for the Zoom class link is 100 and we all are occupied. So just connected, just stay connected and keep your network strong, because now we are full of 100. No other student can enter. And if you are leaving the session, another students will get chance. Okay. So if such kind of the consistency will be there, I will increase the capacity of our platform. Okay, but stay connected and thank you very much for completing this 100. So I will do again and again this free session, and again I want to tell you from the 18th all the detailed part of our Grey's Anatomy with the proper our reference with the Grey's Anatomy. Okay, BD Chaurasia sir textbook, Murray's Anatomy, Thyme Anatomy, total 20 to 30 days session, detailed anatomy for the thorax we are going to do. Okay, so you can stay connected for that. Yes, now this kind of the free session, this is the free session, today is the free session, you can join always, every day, every 2 days later, every 3 days later, we are doing more and more for the our students. And I pasted the link for the our app where you can get the bunch of the videos. Also you can get connected with our YouTube channel, Telegram channel, Facebook channel, where you can get the various our e-notes as well as different videos. Okay, so thank you very much for the joining. Now we are continuing. See here beta, this is our Grey's Anatomy 41st edition, international edition. Can you see, this is the upper rib and this is the lower rib. So the space between the two rib is known as intercostal space, and this is important. Intercostal space is important. For this one, you have to know little idea about the rib. What I want to tell you, magic of two. Yes, magic of two. There is the anterior end, there is the posterior end. Yes, there is the upper border and here is the lower border. There are the two surface, outer surface, and there is the our inner surface. So everything is two. And what you have to remember about the our ribs, that on the lower surface, inner side, there is a presence of costal groove. Okay, so there is the presence of the costal groove. Yes, always at our anatomy classes we draw the diagram properly and we indicate everything. So just to see here, I am showing you. Yes, last class we did for the our ulna, we drawn the beautiful diagrams. Okay, we draw the beautiful diagrams and present them. So in our live anatomy classes we will draw, we will sketch the diagrams for each and every structure, but this is a 3-dimensional anatomy, so we are just looking the 3-dimensional orientation. Okay, otherwise always these all are the our notes, these all are the our e-notes which you can get at our app. So right now we are looking for the rib. Okay, so just I want to inform you, see here, how many intercostal spaces are there? Sir, there are total 12 pair ribs. So if there are the 5 ribs, 1 2 3 4 5, how many spaces are there in between? 1 2 3 4. So if there are the 5 ribs, so 4 spaces are possible. So how many intercostal spaces are possible? Remember, 12 pair ribs, so there are our 11 pairs of the intercostal spaces are possible. Clear, sir? I think there is no problem. Yes, so remember there are total 11 pairs of the intercostal space. Why these intercostal spaces are important? Clinical integration. There are the many times that within the lung, within the pleura, there is the accumulation of the fluid. Okay, there is the accumulation of the blood, there is the accumulation of the air, for which we have to insert the needle and we have to remove the fluid. Okay, so that the patient can be get corrected from this pneumothorax, hemothorax, empyema, this different clinical situation. Okay, so for that purpose we have to know this intercostal space. Now see here, Grey's Anatomy is saying, yes, within this each intercostal space, can you see, there are the intercostal arteries. Grey's Anatomy is saying that there are the intercostal vein. Also, with the proper our surface marking of the lung and pleura, we will be able to remove the fluid inside the our chest. Okay, for this we have to know the surface marking also. So we will refer this all the things, and I am showing you the few more things. Yes, development part we will see at our embryology. So this is the our osteology part I told you in brief, and now we are going to look our intercostal space. So this is the our intercostal space. So in your textbook you will see this is the upper rib, this is the our below rib, and the space between the two ribs, intercostal space, many muscles are found, but 3 muscles important. Okay, outer muscle is outside, that's why external. in between the two ribs. That's why what you will say intercostal, external intercostal. Yes, it is running obliquely, downward, forward, medially. So do you remember the direction? Yes, just use the hand in the pocket. हाथ को पॉकेट में डालो, कैसे जाता है? Downward, forward, medially. So the hands in the pocket, downward, forward, medially. This is the direction of the our external intercostal muscle. Can you see the Gray's Anatomy? Yes, it is running. It is running. What is the direction, beta? Downward, forward, medially. It is running downward, forward, medially, hands in the pocket. While the internal intercostal muscle, it is making 90 degree. It is making anti 90 degree. Its direction R. Yes, its direction is, yes, it is running in this way. Its direction is upward, backward, laterally. Means hands over the shoulder. Upward, backward, laterally. Hands over the shoulder. It is internal intercostal muscle. And on the inner side, there is the our innermost intercostalis. It is divided into the three groups: sternocostalis, subcostalis, and our another muscle, innermost intercostalis or intercostal intimae. It is having the same direction with this second layer. I am showing you the three-dimensional view. See here. Look at this our thorax part, beta. See here. Fine. So this is our pectoral region muscle. Fine, sir. We are doing dissection of this pectoral region muscle. We have dissected. So at the pectoral region, can you see the small muscle, pectoris minor? You are dissecting this one. Fine. Now, can you see this muscle? Yes. Observe for this muscle enlarging. It is enclosing the thoracic cavity. Yes, sir. And can you observe its direction? Yes. When we do dissection, the fibers are running from above to the down, upward, downward. Yes, it is running downward, forward, and medially. And when we are doing the dissection, can you see again? These are the different muscles we are removing. This is the serratus anterior, dissected this one. Yes. And can you observe this another muscle? Look here. This is external intercostal muscle. This is internal intercostal muscle. It is making 90 degree to the our, remember, external intercostal muscle. So this is internal intercostal muscle. It is complete on the front, but when you will turn on the back side, near the our vertebra, thoracic vertebra, it is deficient. Okay, here it is replaced by the internal intercostal membrane. Getting the point? Now try to understand the our other things. On the innermost side, one more muscle will be found. See here, dissection layer by layer. So this is our external intercostal. Here is our internal intercostal, and then this third layer is innermost intercostalis. Actually, this is transversus thoracis. It is our transversus thoracis having the three groups. So I am trying to find out that muscle. Can you observe this muscle? Look at this muscle. We are going inside. Yes, beautifully we are going inside in our thoracic cavity. So this is the our enjoyment of the three-dimensional anatomy. So can you see this particular muscle? Yes. Otherwise, we are going from the behind. So this is the posterior view. Now enlarge, yes, enlarge and go inside. So when you are reaching inside, so can you see? Yes, see here, we have reached inside the thoracic cavity. Look at this bony part. This is sternum. That is the sternum, and this particular muscle is attached to the our ribs. So what should be the name of this muscle? This is our sternocostalis. This is also our muscle of the thoracic cavity. Okay, so this is sternocostalis. And in the same way, I am showing you one more muscle. These are the muscles, these are the things which we always skip. So can you see this is our diaphragm? We are dissecting this one, and look here on the back side. Can you see this another group of the muscle? Yes. Observe this one. Yes, sir. These group of the muscles, they are on the below side. Okay, that's why it is known as subcostalis. So what I want to tell you, intercostal space. So when we will make our notes, I will write down in this all kind of the manner. We will prepare the beautiful notes. Okay, such kind of the notes we will prepare. We will draw the diagram. We will draw the all the muscles, and I will teach you. Yes, there is our three muscles: external intercostal, internal intercostal, and transversus thoracis. Again, the transversus thoracis is divided into the three parts. Yes, sternocostalis, subcostalis, and middle to fourth part is occupied by our, remember, that is innermost intercostalis. Okay, sir. So now after this all the description, come to here next part. You can follow your textbook also. This is our Gray's Anatomy. Okay, and you can follow the because maximum student in India, they are following the BD Chaurasia sir book. That's why I'm taking the reference from the BD Chaurasia sir book. So these are the intercostal space. What is the clinical point regarding this? See here, this is the our intercostal space section. So just add the costal groove. Each rib is having the groove, costal groove, where the VAN vein structures are present. Vein, intercostal vein, then artery, intercostal artery, then nerve, intercostal nerve. These are the very important structures situated at the our intercostal space. So whenever we are inserting the needle, you have to always remember, never damage these our vessels. So just I am showing you, this procedure is known as thoracocentesis. So this is your clinical part, thoracocentesis. So can you see these different images? Yes, this is the thing why you have to know about the our process. You have to know about our intercostal space. Many times we have to inject the needle inside our thoracic cavity to remove the pus, to remove the blood, this all the things, that is thoracocentesis. Okay, and always remember, for this thoracocentesis procedure, the best thing, where you have to insert the needle, okay, you have to insert the needle in 8th intercostal space at mid axillary line, and remember, never at the lower part of the rib, always you have to insert the needle along the upper border. Getting the point? What I want to tell you, yes, this is our thoracocentesis. You are inserting the needle, and never insert the needle along the lower border of the rib. Why? Because at the lower border of the rib, you can see the vein, artery, and the nerve. VAN, neurovascular bundle. If you are injecting the needle just at the lower border, these important structures will get damaged, and due to the damage of this structure, yes, remember, there will be different kind of the vascular, arterial, venous, and nerve related problem. Also another applied, that is intercostal nerve block. Sometimes we have to block this intercostal nerve. So remember, for the intercostal nerve block, you have to inject the needle at the lower border to anesthetize this one. Okay, that is our intercostal nerve block. So these are our applied part. Now come to the our next things. Yes, just few ideas I am giving you for the our intercostal artery. So yes, you can go at our app, there is a one free video. Also you can go for the our YouTube channel, there is a one free video for the arterial supply of the total body. I have taken the arterial supply, 3-dimensional arterial supply of the body 3 months before. Okay, 2 hours video where all the arterial supply of the body in the 3-dimensional way you can look. So just see here, can you see, this is our aorta? Yes sir. And this aorta is giving the thin branches which is running in our intercostal space. So these arteries which are running at our intercostal space, they are known as intercostal arteries. Can you observe this artery? Yes, this is our intercostal artery which is running in the intercostal space. So each intercostal space is supplied by the intercostal artery. Also you will see there are the our intercostal veins. So in our detailed class I will draw this diagram and I will teach you. So just see here, there is the inferior vena cava and the aorta. So here you can see, yes, the intercostal veins, the veins which are running. Yes, can you see, these veins are running in the intercostal space. So the veins which are running at the intercostal space, they are our intercostal veins. Getting the point? Okay, and in the same way there are the intercostal nerves. So we will draw the diagram in our thoracic detail class and we will look each thing. See here, in our body there is a rich network of the nerves. This rich network of the nerve, they are supplying our different muscles. Can you observe this particular nerve? Yes, in each space you will see one particular nerve which is running in our intercostal space. So this is intercostal nerve. So you have seen the intercostal space, you have seen the intercostal muscles, you have seen the intercostal vein, artery, and the nerve. Okay, so now we are dissecting this all the things and we are going inside. So just try to understand again. So you can follow your textbook. We will describe this all the intercostal nerve, we will describe the our this all the clinical point in our detailed thorax class. And yes, intercostal arteries, where it is coming, and we will draw this azygous venous system. Okay, and also this internal mammillary artery we will look. This internal mammillary artery is the best artery for the coronary artery bypass grafting. So that coronary artery bypass grafting is very important, we will look. Okay, why? Because this is the best artery for the coronary artery bypass grafting, not the great saphenous vein. So this is the artery which is used for the myocardial infarction and the angina surgeries. Okay, we will look for this all. And after this all, just see here this thoracic cavity and the pleura. So what is the pleura? Pleura is the covering of the lung. So I am going to show you the pleura and the lung. So now we are going to look for our pleura and the lung. So observe our respiratory system. See here, can you observe? Inside there is the lung. Fine. And these lungs are covered with our serous membrane, which is protective in nature, that is our pleura. So what is the pleura? Envelope of the lung is known as pleura. Pleura is having the two layers, parietal layer and the visceral layer. Getting the point? Again, the parietal pleura is divided into the our cervical pleura, then you can say the costal pleura, then the surface which is towards the mediastinum. What is the mediastinum? See here, this gap is the mediastinum. What is the mediastinum? Always you will get confusion. What is the mediastinum? The gap between the two lungs or the two pleura is known as the mediastinum. What is the mediastinum? Interpleural space is known as the mediastinum. And we will see this mediastinum is divided into the superior mediastinum, upper part, inferior mediastinum, lower part, and again the lower mediastinum, the lower part of the mediastinum, it is divided into posterior, middle and anterior. So inferior mediastinum is again divided into the three parts: anterior mediastinum, middle mediastinum and the posterior mediastinum. Getting the point? So these are our different parts of the mediastinum. So what is the pleura? Again I want to tell you, the covering along this all the our lung, that is the pleura. It is having the two layers, parietal pleura, visceral pleura. Okay, again the parietal pleura is having our cervical pleura, costal pleura, and then the part of the pleura which is at the mediastinal surface, mediastinal pleura, and then at the inferior surface, that is diaphragmatic pleura. So there are the four parts of the parietal pleura. And then what you have to remember, there are the two recesses not shown in this three-dimensional image, but I want to tell you two spaces in the our pleura. One is situated here, that is known as costo, because here is the ribs, and then here is the diaphragm. So the space which is formed at this part, exactly at this part the space is formed, that is known as a costo diaphragmatic recess. And another recess is found at this part. Here is the our mediastinum and the heart. So one space is found at this part, that is the our costo mediastinal. What I want to tell you, costo mediastinal recess, and here is the our costo diaphragmatic recess. What is the importance? Costo diaphragmatic space, from here we do pleural tapping. What is the pleural tapping? Yes, you are injecting the needle and then you are removing the fluid from the pleura. Means you are doing the thoracocentesis. Thoracocentesis is done at the our this space, costodiaphragmatic, but you will do the pericardiocentesis, the abnormal excessive accumulation of the fluid within the pericardium that leads to the pericardial effusion. For the treatment of the pericardial effusion, you will remove the fluid from this space, that is our pericardiocentesis. So pericardiocentesis is done at which part? Remember, your answer is yes, costomediastinal recess. So we will draw the diagram, we will write down the theory, we will make the different points for our MCQ exams, for our university exams, and we will not leave any kind of the question in our detailed session. So right now this is the our lung. Now description for the each lung. See here, lung. Can you see right lung? Yes, right lung is shorter. Why the right lung is shorter? Because right side there is the liver, so liver is compressing, so right lung is shorter but broader. And when you are observing, so can you see there are the fissure? Yes, this fissure is running horizontally, horizontal fissure, another is running obliquely, oblique fissure. So there are the two fissures in the right lung which is dividing the right lung into the three lobe. Can you see? Upper lobe, middle lobe, and the lower lobe. Yes, upper lobe, middle lobe, and the lower lobe. So three lobes are there. And when you will look for the our left lung, just see here, this is our left lung. So when you are looking the left lung, there is no lever on the left side. So left lung is comparatively longer and narrower, and in the left lung you will see one oblique fissure is there. This oblique fissure will divide the lung into the upper lobe and the lower lobe. Only two lobes are present in the our left lung, and left lung is presenting the space to accommodate the heart. As you all know, the heart is situated on the left side, so the left lung is having the space to accommodate our heart. So this part is known as, this concavity is known as cardiac notch. Remember, the cardiac notch is present in the left lung, not in the right lung. And there is a one tongue like free projection. You can see there is a one free projection, tongue like free projection. This tongue like free projection is known as ingula. Okay, so now see here, at the detailed part of the video I will teach you. Yes, just we always do the three-dimensional orientation, our image based session also. So for the upper limb, you can see this previous session. Right now I want to tell you, in the our detailed class I will teach you the bronchopulmonary segment. See here, right lung, how many bronchopulmonary segment? This is very important. So suppose this is the our right lung, you are looking from the lateral side. Okay sir, there is the one horizontal fissure, there is a one oblique fissure. So this two fissures are dividing our right lung into the three lobes. Can you see? This is the upper lobe. Yes sir, can you observe? This is the our middle lobe. Yes, this is the our middle lobe. And can you observe, there is the our lower lobe. So here is the our lower lobe. So there are the three lobes. So in detail class we will draw such kind of the images, and then I will teach you the bronchopulmonary segment. Yes, what is a bronchopulmonary segment? The lung, each lobe is again divided into the small parts. They are known as segment, which are supplied by the tertiary bronchiole. So what is a tertiary bronchiole? Again, when we will see our detailed part I will teach you, but right now just see here, this our tracheobronchial tree. Can you see this tracheobronchial tree? So just try to understand what is happening here. Yes, you can see this is the our hyoid bone, this is our thyroid membrane. Can you see? This is the our thyroid cartilage. Just below to it there is the our cricoid cartilage, and when you are coming down, so this is our trachea. Yes, this is the trachea. So this trachea is dividing at the carina. Remember, it is not the Kareena Kapoor, it is the carina. Okay, the sister of the Kareena is the carina. So in a funny way, the mother of the Taimur is the carina. I'm just making a fun so that you can remember this important point. This is the carina, where the cuff receptors are present. So at this part the cuff receptors are present. So whenever any foreign body is coming, it is getting irritation and the cuff is induced. Okay, so now this trachea is dividing into the primary bronchus, which is supplying the our lungs, and then each our primary bronchus is dividing into the secondary bronchiole. Can you see? On the right side, 1, 2, and the 3 secondary bronchioles are there, and again these are dividing into the minute branches. These are our tertiary bronchiole. So the tertiary bronchiole are supplying the segment of the lung. So I want to tell you, the tertiary bronchiole, they are supplying the segment of the lung that is known as our bronchopulmonary segment. So what are the different bronchopulmonary segment? Very important question, because for the surgery, because of the surgery, what I want to tell you, you will see the definition of the bronchopulmonary segment, that these are anatomically, physiologically, surgically well defined sectors of the lung. These are anatomically, surgically, physiologically well defined sectors of the lung which are supplied by the tertiary bronchiole. समझने की कोशिश कीजिए, पूरी दुनिया में सबसे मोस्ट कॉमन कैंसर कौन सा है? लंग कैंसर. नाउ ट्राई टू अंडरस्टैंड, इन केस ऑफ द लंग कैंसर, अर्लियर वी हैव टू रिसेक्ट आउट ऑल द लंग. पहले जब सर्जरी करते तो पूरे लंग को काट के निकालना पड़ता था. वेरी डेंजरस सर्जरी. Now what is the situation? Now we are having the knowledge of the bronchopulmonary segment with the help of our anatomy. Okay, so now if the cancer is only involving the small part of the lung, don't remove entire lung, remove just only that bronchopulmonary segment. That's why we are saying anatomically, physiologically and surgically. Anatomically, because each small segment of the lung is independent in structure. It is not depending on the sideways structure. Yes, physiologically, because the function of the each our, yes, each our bronchopulmonary segment is independent from the function of the another bronchopulmonary segment. Surgically, because if you are removing, if you are cutting one segment of the lung, no effect is going to harm the other segment of the lung. That's why these are anatomically, physiologically and surgically. You have to count for the three departments: anatomy department, physiology department and surgery department. Okay, so these are our three independent three important terms. So now see here, you can observe the bronchopulmonary segment. For it, you have to make the Y. So now see here, in the right lung there is the our upper lobe, first bronchopulmonary segment. Suppose this is the anterior side, so you will say this is our anterior lobe, and here you will observe this is posterior side, so you will say the posterior lobe. Getting the point? And in this way you are going to observe there are the three bronchopulmonary segment in our upper lobe. Fine. Now see here, there is the how many bronchopulmonary segment in the middle lobe. So just for it you have to draw one vertical line. So can you see one vertical line which is parallel to this Y like structure? Fine. So it is dividing the our lung into the two parts. What are the different two parts? See here, yes, one is our medial and another is lateral. Remember, this is lateral view, this is lateral view. So we will draw such kind of the images in each and every part. Approximately 20 to 30 days we will take for the all the detailed description of the thorax class, which will help you for your university exams, which will help you for your MCQ exams. Yes, your NEET, your JIPMER, AIMS, USMLE, PLAB, any kind of the exams you want to do, you can crack that one, because we will go thorough study. Okay, so what I want to tell you, the medial and lateral, so these are two bronchopulmonary segment in our middle lobe. Okay, now see here, this is the our lower lobe. So for the lower lobe study, you have to draw one line vertical and two lines, yes, one line horizontal and two lines vertical. So how many bronchopulmonary segment here? Can you see? This is our basal lobe. So at the basal lobe, you can see this one is apical basal. Okay, this is anterior side, so you will say anterior basal. Fine. Here you will see this is lateral side, so you will call it lateral basal, and this one you will call, this is posterior side, so you will say posterior basal. Yes, there is medial basal lobe also, but I told you this is the lateral view, so medial basal cannot be seen from this view. This is important line what I want to tell you. The our, yes, medial basal lobe, the medial basal lobe cannot be seen from this side. So how many bronchopulmonary segment in lower lobe? Answer is 5 bronchopulmonary segment in basal lobe or your lower lobe. So total how many bronchopulmonary segment in right lung? See here, 3 plus 2 plus 5 means total 10 bronchopulmonary segment, 10 on the right side and as well as on the left side. So left side I will tell you in detail class, but in this way you have to remember why it is important, because now clinical part is important. Try to understand. There is the question, which lung is most commonly affected in infection, right lung or left lung? Your answer is the right lung. Why? Come to our three-dimensional anatomy. See here, can you see the bronchial tree? Yes sir, this is the trachea. Here is the right bronchus, here is the left bronchus. So foreign body is coming from above and left bronchus is making acute angle, it is obliquely, while the right bronchus is wider, shorter and more in line with the trachea. So any foreign body it will go here, so right lung is more susceptible for the infection. Are you getting the point? Right bronchus is more susceptible for the infection. Now the question, in the right lung, which lobe is more commonly infected? So can you see the pathway is very straight with the lower side. So lower lobe, or you can say basal lobe, is most common site for the infection. But now your question for the different MCQ exam, in this lower lobe, this green color part, the foreign body is lodged, the foreign body is impacted in which part? So your answer is posterior basal. So the most common site for the infection, that is the our posterior basal. But remember, in erect posture. So this is again another twist. If the patient is sitting, if the patient is erect in position, then this part will be affected, while in lying down position, this apical basal lobe is most common site for the infection. Okay, in which condition? In supine position. So these are the very nice questions from the your medicine part, anatomy part. So this is the our integration, which is the demand of the National Medical Commission and competency based medical education. Getting the point, everybody? Okay, so now after this part, yes, I will tell you each and every detail in our detail class. We are starting from the 18th of the thorax, and the first 20 students, they can get 50% flat off. Okay, so you all can enroll for that. Just one kind information, and I already pasted in the chat box. Yes, you can go for the chat box. There is the link for the different free videos, okay, as well as paid videos are there, but I will suggest you at least you have to stay connected with our free videos channel. And if you are interested for the paid subscription, you can go for that also. Okay, so you can get the anatomy video, physiology video, biochemistry videos, patho, pharma, micro, they are under upload, as well as medicine surgeries videos are under upload. Okay, so what I want to tell you, after this lung part, come to the our heart. So just see here, yes, there is the video. You can go for the our video for the heart just on the last Sunday for the class, Philippines class. So again, I missed that class. All the Philippines students, they supported too much and we really enjoyed. That video is available as a free. Okay, so you can get that video, the arterial supply of the heart. So right now I am just telling you the three-dimensional blood supply in a short and sweet manner. Yes, so thank you very much all the students. All the 100 students are here. I will try for the our further session where we can do the more larger platform. I will take the subscription for the 300 500 students, so more students can join us. Okay, yes, yes, one more thing, if any student is having the doubt or any kind of the any kind of the query, at the last we are going to do the live doubt discussion session, but at that time you can ask. So right now see here, this is our heart external feature. I told you in the previous class, magic of four chamber, right atria, yes, right ventricle, left atria, left ventricle, magic of four. Okay, and then I told you the four borders. What are the four borders of the heart? Yes, right border, then inferior border, then left border, and then superior border. Four borders. Okay, and then there are the four important depression, or you can say sulci. So just see here, there is the our right atrioventricular sulcus, and here is our left atrioventricular sulcus. This is our interventricular sulcus, and also you will see the posterior side interatrial sulcus, which is not properly visible. Okay, so I told you the arterial supply of the heart, which is very important. So last time we did that section. Okay, so last time we did that our beautiful three-dimensional our description. Okay, fine, not getting that one. Okay, fine. So you can get that video at our app. Right now see here, we have seen the arterial supply. So heart is supplied by the our coronary arteries. So just one short and quick revision. This is the our right coronary artery, which takes origin from the anterior aortic sinus. Then it is running in between the our right atria and the right ventricle. Then it is running towards the our right border. Yes, it is running towards the junction between the right border and the inferior border. Then it is winding back. It is winding back. Can you see? It is winding back, and it is reaching on the back side. Can you see? It is reaching on the back side and near the our interventricular sulcus. Can you see here? Yes, it is dividing into the small transverse branch and our posterior interventricular artery. Getting the point? So these are the our things. Fine. So this is our right coronary artery. And can you see the left coronary artery? See here, the left coronary artery is here. Okay, the left coronary artery is coming, and it is immediately dividing into the our anterior interventricular artery. Can you see this artery? Yes, this is our anterior interventricular artery. Okay, so this is our anterior interventricular artery, fine, which is also known as LADA, left anterior descending artery, which is also known as, this artery is also known as the widow's artery. I will post the link, you will get the link. Kindly recall me at the end of the class. Okay, now try to understand. These are the arteries and different branches are there. You can go with that video, and when we will do the our detailed class, at that time I will teach you the largest vein of the heart. Can you see this is the largest vein of the heart? Remember, superior vena cava is not the largest vein of the heart, inferior vena cava is not the largest vein of the heart. Which is the largest vein of the heart? Yes, superior vena cava, inferior vena cava, they are systemic vein. They are not the vein of the heart, they are vein of the body. This is the largest vein of the heart. What is the name? This is known as coronary sinus. What is the sinus? Large vein. Large vein. Okay, large gap filled with the venous blood is known as sinus. So this is our coronary sinus. It is the largest vein of the blood. Okay, largest vein of the our heart. What are the other veins? See here, in detail class I will teach you. This vein which is running with the our anterior interventricular artery is known as great cardiac vein, and this another vein which is running at the margin is known as our small cardiac vein. Can you see this one? This is our small cardiac vein, and also you can see here at the middle side which is running with our posterior interventricular artery, this is known as middle cardiac vein. So what I want to tell you, the coronary sinus is having the three important vein: great cardiac vein, a small cardiac vein, and middle cardiac vein. But other many veins are there, like the our anterior cardiac vein, like the vena cordis minimi, the video which I launched from the Ukraine University. You can go for that from the foreign. I launched that video, very beautiful video on the our right atria. You can go for my YouTube channel. So this all the description I did there. Okay, so these are about the our thorax video, three-dimensional orientation. There is in our YouTube. I will post the link, and also we will look for the our esophagus. See here, we will look for the our esophagus. See here, this is the esophagus. Esophagus is important. Why? Because we insert the Ryle's tube. We insert the Ryle's tube in each and every department. So we will read the our esophagus also in the thorax part. Yes, this esophagus is not straight. It is having the curvature. And remember, esophagus is having the 25 centimeter length. So we will create the meningitis and the mnemonics. Okay, we will create the meningitis and the mnemonics. So can you tell me how many structures? What are the different structures having the 25 centimeter length? So remember your trick, DUDES, dudes. Okay, so total 5 important structure having the 25 centimeter length. D for remember the duodenum. Yes, U for remember the ureter. D for remember our descending colon. E for, yes, esophagus. Esophagus is having 25 centimeter length, as well as stomach is having. These are the structures with our 25 centimeter length. This is important question. Special, the duodenum is important, our esophagus is important, and ureter is important. So these three structures are very most important for the 25 centimeter length. And we will see the structures, yes, constrictions of the esophagus. So that is another very important topic, constrictions of esophagus. Okay, so I will teach you this different constrictions of the esophagus. Okay, can you see this is the image from the our Dhingra textbook? Also you can get in our Gray's Anatomy, or maybe it may be given at our GIT section. So we will discuss about that. Okay, so these different things we will talk in detail in our live thorax class, which is going to start from the 18th. Okay, and yes, registration is open. You all can join that. Yes, all the three-dimensional orientation with the Gray's Anatomy reference, Murray's Anatomy reference, also any textbook which your university is preferring, we will do. Okay, so this is our heart and I'm looking for the esophagus if it is given here or not. Otherwise in the GIT segment, yes, we will talk also about our coronary angiography, and we will see our real images. We will see the real images. Okay. So different kind of the arteries and the veins we will observe. And esophagus and the trachea we will observe. Fine, it is not there, but right now I am telling you esophagus is presenting the few constriction. The esophagus is having the upper constriction at the cricopharyngeal junction. So I am drawing the diagram, because good diagram we are not able to get. So just I am drawing one diagrammatic presentation. See here, the upper funnel like shaped structure is known as our pharynx, and then it is continuing as the narrow muscular tube, that is our esophagus, and then this esophagus is continuing as the wide dilated part, that is our stomach. So this is our esophagus. Remember, this esophagus is having certain narrowing. This is due to the cricopharyngeal junction, and when you are coming down, there is our location of the trachea. So just see, this is our trachea. Trachea is dividing into the right bronchus and the left bronchus, and this trachea is arched by the our arch of aorta. So here is the arch of aorta. So remember, the second narrowing of the esophagus is done by our arch of aorta. Next narrowing is done by the our left bronchus, and the last narrowing is due to the our diaphragm. So suppose this is our diaphragm. So these are the 1, 2, 3, 4 narrowing of the esophagus. Sir, why this topic is important and why this will ask in your university exams, in your MCQ exams? Because you are inserting the Ryle's tube, nasogastric intubation, because the many people they are unable to eat from the oral route, so you have to insert the tube. So when you are inserting the tube, at that time you have to care about the narrowing at these 4 parts, and in the radiology there is a 5th narrowing is found, that is due to our left atrial hypertrophy. Okay, so 5 narrowings also mentioned, and in your surgery, ENT and medicine, you will see these 2 constrictions are very close together, so 3 narrowings are also told. Remember, what are the different vertebral level? Very important question. This cricopharyngeal junction is the narrowest part of the GIT. It is located where? It is located at our C6 level. MCQ. Arch of aorta, it is located at our T4 level. Yes, left bronchus is located at our T10 level, and the diaphragm is located, yes, sorry, this is our T6 level, and this is as T10. How can you remember? 4 plus 6 is equal to 10. Okay, how can you remember the cricopharyngeal junction? C is there, just turn this lower end, so you can remember the 6. Okay, and later I will tell you the distance from the incisor teeth. Very very important MCQ in detail. Complete 1 hour session we will do for the esophagus. C6 is located, yes, 6 inches, 9 inches, then 12 inches, and then 15 inches from the our upper incisor teeth. So this is just a short quick revision. I will tell you in detail. So only one thing you have to do improvement here. In place of the 12, you have to remember 11. So this is the way how you can remember the constriction of the esophagus. Just you have to read the table of the 3. 3 2 is 6, 3 3 is 9, 3 4 is 12, 3 5 is 15. And if you are converting into the centimeter, this is very important question from your surgery. Each fact is question. So you have to multiply by 2.5. So this is our 15 centimeter MCQ. Then second narrowing from the upper incisor teeth, that is at the 22.5 centimeter. Then third narrowing at our 27.5 centimeter, and then fourth narrowing at the our 37.5 centimeter. Okay, you can say 37.5 is equal to approximately 40 centimeter. So what is the distance? Can you see 15 and 40? So what is the length of the esophagus? 40 minus 15 is equal to 25 centimeter. Okay, so each and every fact is your question. So thank you very much. This was one short and quick review with our 3-dimensional orientation. I will teach you the thoracic duct, this all the things in our detailed class. So this was the free session for all of you, for the benefit of you all the students in this lockdown period. Thank you very much. You will get this recorded video at our app. Thank you. Now we are starting our live doubt discussion session.